Hello, in this video I'm going to be talking about hair loss from chemotherapy. How can you prepare for it? How can you take the best care of yourself during this difficult time? And also I'll talk at the end about preventing or reducing the risk of hair loss. Hair loss is caused by chemotherapy in general because chemotherapy affects rapidly dividing cells, and the hair on our head and elsewhere on our body those cells are dividing pretty rapidly. So they are affected actually quite early on from chemotherapy. If you've been told that this is a possible side effect of your chemotherapy, then this video is for you. Before I go on, I want to invite you to subscribe to our channel. We're always putting out new content, we're updating previous content, and we respond to your comments. So if there's a video you'd like to see, pop a comment below. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report. So I've explained a little bit about why chemotherapy-induced hair loss happens. How can you prepare? This is one of the hardest side effects of chemotherapy. Now, what I've learned from people who've been through it is that once it happens, people are actually better than they are before it happens. That doesn't mean that it's fun and easy to lose your hair, but that once people adjust to it, they recall how hard it was when their hair came out. I believe that we have images in our head of cross-cultural rituals of hair shaving. So when people go into the military, their head is shaved. When they go pursue a religious or monastic life, their head is shaved. When there are multiple other transitions around the world, head shaving is part of that ritual or that rite of passage. So we see in our heads this sort of loss of our individuality. And for people who are Black or for people from other cultures, hair loss is really hard because our hair is our identity. And I think this is particularly the case for some cultures and groups more than others. If you're watching this and you're thinking, this doesn't bother me at all, that's great. But for most of you watching, this is a loss of identity, and there's grief and rage and sometimes even disgust at loss of hair, the way your body looks or how our culture handles hair loss. It can be really upsetting for people around you as well, especially for young children or children in the sort of tweens, 11, 12 age, because they're also getting to know who they are. So this can be really hard for them. And some of the things I'll be sharing in a moment will address that issue in particular. Younger kids tend to do okay with it, and older children tend to do okay, but that pre-adolescent, early adolescent age, this can be really hard for kids that age. So what can you do? Number one, validate your own experience and grief. A lot of people, including your medical team, will say, it's just hair, you're still beautiful. And yes, it is just hair, and yes, you are still beautiful, but it's really a shock to the system for a lot of different reasons. Loss of identity, and I won't look like myself, and I might not look like a woman, and we're not used to seeing ourselves without hair. So this is hard. So validate your own emotional experience. The other thing I would recommend doing is making sort of your own ritual about it. Decide ahead of time how you want to do this. So some people will get a wig or a ponytail and bangs, or fringe, if you call it fringe if you're in the British Isles. So get something that can help you with that transition. Even if you don't think you want to wear a wig, having one for times you want to be private about what's going on in your life can be very helpful. If you don't have the finances to buy a nice wig, you'll be surprised that people will donate very nice wigs when they're done with them. So you may be able to get a wig that's been previously enjoyed, that's been cleaned and prepared for another person, so you don't have to pay out of pocket. Your medical team can also write a prescription if you have insurance. Insurance can often help offset the cost. Some people want to go crazy and get lots of different wigs. I've had people get a red wig and a blonde wig and a brunette wig, long hair, short hair, so you can play around. If you don't feel like playing, that's okay, but lots of people find being creative and fun, have some fun with this, can be a useful way to offset the grief and try out different sort of identities, if you will. The other thing that I recommend if you have long hair is that you cut your hair into a shorter style. You might want to try a really short haircut like I have, or something that's just shorter like shoulder length, and that can help with the transition. When does your hair start to fall out? It usually starts to fall out gradually about 2 to 3 weeks after your first chemotherapy treatment. Now, we all lose about 100 hairs a day, but you will notice every single one once you get chemotherapy. You will notice all those hairs on your pillow or in your brush in the morning. When it starts to come out in larger quantities, when you start to pull your hair out and you notice a clump of hair, you may wish to shave your head. Why is that? Because having hair falling out in the shower or on your pillow that's long can be really dramatic. And at that point, you may want to sort of decide this is the day. And you can go to your hairdresser or have a friend come over, and you can put on some music, and you can have your friend or your hairdresser shave your head for you. It's a way where you're not so much a victim to time, but you're saying, this is the day. Now, everything I'm telling you, I have learned from patients. This is not something that we learn in medical school. So if this resonates, great. If it doesn't, it's just not for you. Everybody's different. It's really important that you honor your own experience and not do something other people are telling you. Some people will say, you should dye your hair before it falls out and play around with a new color. There are no shoulds. What feels right to you is really important. So we've talked about why it happens, when it might happen, what it's like when it's happened, different strategies you can take to prepare, what to do once it starts coming out. It's important to grieve the day that you shave your head, or do whatever you need to do. I've had patients have their grandkids get removable markers where it's sort of like a raised color and do like peel-offs, and helping the people around you prepare is really important. For kids in that 10, 11, 12 age range, some of them don't want to see you without your hair. It's not because they don't love you and don't think you're beautiful. It's, again, if you recall at the top of the video I talked about, they don't even know who they are, and seeing shifts in somebody's identity, which hair represents, can be hard. If it's possible, don't take it personally. And if it does hurt your feelings, talk about it with another adult as opposed to burdening your tween age kids with your emotions. So yes, they need to see that you have emotions, but be careful how much you share of that regarding this experience in your life. The one thing I want to prepare you for is that your scalp can be very tender when your hair comes out. This is something a lot of people aren't told. Doctors know it, but they forget sometimes with all the other things they're doing for you and coordinating your schedule and teaching you about those serious medical side effects, but your scalp can be tender. You may notice when you put your head on the pillow, your scalp is tender, or you're even just to the light touch, your hair may feel like it's hurting. That's normal. It tends not to be severe. It tends to be something you can alleviate with an over-the-counter anti-inflammatory, and it will pass. I've seen maybe one person where their scalp remained tender for several weeks, but it's usually a temporary side effect. So many of you have been generous with other people in the Yerbba community with your tips and tricks, and it's so kind of you to share those ideas. You can also put a question in and we'll get back to you. We don't curate any of the questions, we respond to everything. The last thing I said I would talk about is preventing hair loss. So there are some things that can be really useful in reducing the extent of hair loss or decreasing it so dramatically that you may not even need a wig if you were planning on getting a wig. And these are cold caps. These work by running cold water through a cap that goes on your head. These can be used for men and women who don't want to lose their hair. It needs to be used with your very first treatment, and it can be uncomfortable. We have a whole video we'll link to here about cold caps, but that cold can be really uncomfortable, but it's really effective in decreasing the amount of hair loss that you will experience for many, many people. And this can be really, really helpful. Insurance is starting to cover cold cap therapy if you have insurance, And it can be something you'll want to talk about when you get taught about chemotherapy. Talk with your medical team about, do they have space for cold caps? Do they rent out cold caps? And it's a bit of a nuisance, but if this is a really important thing to avoid, I encourage you to look into this before you start chemotherapy. It tends not to work even after the first chemotherapy. That alone can cause the hair loss. So you want to act on this and learn more about it. And again, we have videos about this and how it works and what to expect. I've covered a lot. I hope it's been helpful. Again, drop a comment or question below. Go to yerbba.com to get your personalized report to learn more about whether chemotherapy might be part of your treatment plan and whether this is a side effect you might even expect. Thank you for watching. We'll see you next time.